state preparing for Ebola tonight. It's putting people on edge nationwide. And since the first diagnosis in Texas last month, Ebola-related calls at the CDC have soared from about 50 a day to more than 800 now.
Today, ABC 17's Lindsay Burning talked to people who respond to emergencies here in mid-Missouri. And Lindsay, you learned they're starting to prepare right now just in case they get a call about a possible Ebola patient.
Joey, earlier this month, the CDC released guidelines for emergency medical services and first responders about how to manage patients with known or suspected Ebola virus. John Metz with the Columbia Fire Department says all personnel at Columbia Fire were trained last week on Ebola.
Any number of viruses can sicken a first responder, so we're always concerned about the transmission of diseases. So we have a very strong infectious control policy. We follow a PPE procedure where we make sure that we keep a barrier between us and any blood or body fluids.
PPE stands for personal protective equipment. Metz says when first responders are called to any infectious virus, they wear gloves, goggles, and masks. And if they think there will be bodily fluids, they also wear gowns and face shields. James Basinger with Cole County Emergency Medical Services went to the state emergency medical meeting about Ebola we reported on yesterday. He says Cole County EMS will start training all of its crews to be able to identify the symptoms in Ebola patients.
The three main things that we're going to kind of work with whenever we have a response is, number one, we have to make sure that our crews are able to properly identify anybody who was possibly exposed to Ebola. The second portion of that is make sure that our crews are protected, wearing the proper equipment that they need to so they can safely take care of the patient. And the third thing is we also have to have a coordinated and a mutual response with everybody involved.
The CDC guidelines also say EMS services must alert hospitals before arriving if they have a possible Ebola patient, so that the hospitals have time to prepare. And Basinger says the CDC has official guidelines of how to clean and disinfect ambulances after they transfer an infectious patient. Metz tells me they are receiving guidelines from the CDC via the Missouri Division of Health and Senior Services. He says they get updates on the Ebola virus about every other day, and he expects that they will continue to receive more as the virus progresses in the U.S.